Hello, everyone. Welcome back to my podcast. Welcome back to my channel. It's Pharmacology Difficult Podcast. And wishing everybody a very wonderful, awareness full of World Hypertension Day. And today is 17th of May 2026. So, how we can increase our awareness and celebrate the day that is the important day of today, World Hypertension Day. So, I have got for you the newest breakthrough blood pressure medications and a brief overview of each one of that. So, first of all, let's talk about the newest recent additions to the hypertension treatment. The first one is Baxdrostat. So, it's a novel aldosterone synthase inhibitor that disrupts the production of aldosterone before it can cause salt retention and high blood pressure. It's an investigational drug, first in class, very highly selective drug, and it lowers the blood pressure by reducing the production of aldosterone, a hormone that causes the body to retain salt and water without interfering with the cortisol production. And medical condition it can be used in is for resistant hypertension. It targets the treatment resistant or uncontrolled hypertension who are already taking more blood pressure medications without success. In such patients, it targets the resistant hypertension, then primary aldosteronism. It can cure that also. It is also in clinical development for treating this excess aldosterone production. And it is in phase 3 success. And the target reach is approximately 40% of the trial patients. They have achieved a systolic blood pressure reading below 120, 130 millimeter Hg. And unlike some other mineralocorticoid receptor antagonist, it is a very highly selective drug. It spares the CYP11B1 enzyme and inhibits only the CYP11B2 enzyme, which makes aldosterone. So it is not affecting the cortisol production, it is only affecting the aldosterone production. This helps avoid many of the hormonal side effects associated with older therapies. Its side effects, it is a very well tolerated drug, and clinical trials have noted mild to moderate adverse effects. Occasionally, some elevated potassium levels like hyperkalemia. And when there is a discontinuation of the drug temporarily, then this hyperkalemia, which is caused, it can actually resolve. Second important drug that I want to talk about is aprocitentan, and it's an endothelin 1 receptor antagonist. It is a first of its kind drug with a completely novel mechanism for treating resistant hypertension. It blocks the endothelin receptors that causes the blood vessels to constrict, widening them and actively lowering the blood pressure. Next important drug, lorundrostat. It is similar to baxdrostat. It inhibits the biosynthesis of aldosterone. It is also in early phase trials. While amongst these drugs, aprocitentan is an FDA approved drug. It is approved in March 2024. It's a first new class of oral antihypertensive medication indicates. Then another recent advancement in blood pressure medication, it focuses as an experimental long-acting injection administered every 3 to 6 months that inhibits angiotensin production. Angiotensin, you all know, is a chemical that constricts the blood vessels and raises the blood pressure. So, zilebesiran, it acts as a long-acting injection. I want to talk a little bit more about zilebesiran. Zilebesiran is an investigational RNA interference therapeutic under the development for the treatment of hypertension. RNA interference, that is RNA small I, that is the abbreviation. It uses small interfering RNA, siRNA, to target and degrade the messenger RNA, mRNA, that codes for angiotensinogen. By blocking the production of angiotensinogen, it prevents the formation of downstream hormones like angiotensin 2, which causes blood vessels to constrict, finally raising the blood pressure. And it is phase 1 and phase 2 clinical trials have shown quite good efficacy, meaningful results. It is currently advancing through the phase 3 clinical programs. Clinical trials have indicated favorably safety profile, with most common and mild side effects being temporary pain, erythema at the injection site, which are very common side effects, not a permanent one. Renal and hepatic safety. The drug does not cause major renal, hepatic, or electrolyte disturbances. And because it is still in clinical testing, it has not been approved for use for evaluated for safety and efficacy by FDA yet. So this is how we have celebrated today World Hypertension Day. Hope you like this information about the wonderful drugs and hope you found it useful. If you did, don't forget to like and subscribe my channel. Till the next time, thank you. Take care. Bye bye. Mummy,